All right, can you tell how dilated you are without checking your cervix? That's what this conversation is about. I'm Lo, former labor and postpartum nurse, mama of 4. I want to teach you about something called the purple line. This is what the purple line might look like. Obviously, it can look different depending on skin tone and how it presents on our bodies, but essentially the idea is that when we are in labor, as we dilate and as our dilation progresses, there is this purple line kind of right above our anus that moves kind of up towards our back that gets longer and longer and longer as we are more dilated. So the idea is we can pay attention to this purple line, and without having to do an internal cervical exam, we can have this idea of how far along you are in your labor. So this image here kind of shows you how the dilation correlates to the centimeters or the length of the line. And it is not 1-to-1. So it's not like 1 centimeter equals 1 centimeter dilation, 2, 2, 3, 3. It's like a 1 to 2 range, 2 to 3, etc. So you can see all that here. This is not a perfect science. It is not something that everyone is willing to rely on. But the idea is there that as you move through your labor, this line will extend. And as you watch that extension, you can know that labor is progressing and cervical change and dilation is happening as well. So back in this initial question, her provider isn't necessarily saying like, we will know exactly what your dilation is, but she can take a peek at her butt and see if there's any kind of presence of a purple line. Now that doesn't necessarily say, oh, you're exactly 6 or 7 centimeters, but if you were to see a purple line, especially around 37 weeks or 38 weeks, it's just an indication that there is something going on in there. Maybe there's a little dilation happening. If you don't see it, it might say, hey, like you're not dilated yet, but at this point, it's not a big worry anyway.